this every fortnight, every second, and of course, last week of the month. And we yield the floor to the host of that segment, the founder of Commod Cancer Foundation, Dr. Dennis Ejo. This time, she will be looking at collaboration and survivors and advocates leading in charge. Dr. Dennis Ejo, over to you now. It's always a pleasure to hear from her.
Oh, yes, Dr. Denise Ejo is, of course, full of smiles and happy to be here. It's Christmas season where she is, just like here.
You can see the tree already behind her.
Good morning, guys. Good morning. The compliments of the season. Good morning, viewers. Welcome to another edition of Kakaki Cancer Awareness with Dr. Denise Ejo, the CEO of Commod Cancer Foundation. Together we fight, together we win. We all champion our cause together. First and foremost, I'd like to wish everyone compliments of the season. We're drawing to the end of 2024, and we need to always recognize it's important to celebrate small wins, especially cancer patient survivors. We have lost a number of our comrades along the way, and so we take this opportunity to remember them all. May their souls rest in peace. Amen. It is pivotal also to make sure that we do not ignore facts. 1 in 2 people will be diagnosed with cancer, and this has been since 2023. And 70 to 80% of people in low middle income countries will be diagnosed with cancer and die. So the faster we learn to understand and listen and get advice and seek support, the better our chances are of survival. And so I take this opportunity to say to you all, ignorance is no longer an excuse. Good morning, all. Here we go again. What are we talking about today? Survivors and advocates leading the charge. You know, sometimes we always forget what we're supposed to be doing. So in the house, what have I got? I've got 3 fantastic advocates. Who are they now? So let me start. I'm going to use my screen to this time and introduce them briefly. Abigail Simon Hart. Hello, Abigail.
Morning, how are you?
Fine, thank you. Dozie Akwarandu. Good morning.
Good morning, Dr. Dennis. Good morning, viewers.
Gloria Oku. Can you hear me?
Yes, sorry, I didn't realize I was on mute. Good morning, everyone. Good morning, viewers. Hi, Dennis.
Good morning, and Mary Gloria. Oji, good morning.
Good morning, Dennis. Good morning, viewers.
Gosh, you're all looking very nice and very Christmas. It's very nice to see you. It's the end of the year. So I'm going to start this segment. Let me start. As we draw to the end of the year, it's the last, this is December, and as you know, we've started to fundraise for cancer patients. As normal, we started it last year, and this year we are doing the same thing. So those of you who would like to donate to Commod Cancer Foundation, we are giving out 25,000 to at least, hopefully, if we get our target, 100 to 200 cancer patients across Nigeria. We will tell you as soon as our money is complete how to get access to the funds. That's 25,000 cancer patients across Nigeria. So please make sure you watch this space so that you can have an opportunity to get it. As I say, together we fight, together we win. So today, what are we talking about? So I'm going to give you a brief background of all of us being together today. On 24th of November 2024, a group of approximately 100 cancer champions convened for the inaugural Cancer Champions Conference. On November 24th, sorry, I've got to go back again. During the event, a smaller team representing the broader community, as you can see, there are only 5 of us here, community launched a coalition aimed at uniting cancer patients across the geopolitical zones in Nigeria. Seeking to foster a unified voice, transcending barriers such as NGO affiliations, cancer type, religion, gender, and other differences. And so today in the house, I'm going to be bringing this conversation, and I'll tell you who these wonderful people joining me are. So who am I? Let me start to introduce our guests. Mary Gloria Oji is Nepicine president. Is that correct? I like the way you use the word president.
Gosh.
Say hello to everybody so everybody knows who you are, please, because you are quite a lot.
Hello,
Abigail
everyone.
Simon Hart, Bricon Foundation CEO, I would like to say. Is that correct?
Correct. Good morning, everybody. Nice to be here.
Awesome. Dozie Akurando, Nest of Hope CEO. Am I correct?
Absolutely correct. Good morning, everyone.
Thank you. You're the only man here anyway, so it's a lot easier.
Always
And
blessed.
Gloria Oku, Gloria Foundation.
Glorious Cancer Foundation.
Gloria's Cancer Foundation. You see, now, you don't read paper because if you read, you would have corrected that by now. See yourself now. Awesome. Thank you, Gloria. To name a few, because there are quite a few of us that are part of this coalition, but we can't have everybody on. So, ladies and gentlemen, I'm going to start with this interesting conversation, and to our viewers, sit back and listen to what's been going on as we draw to the end of 2024 and how the events unfolded. So, Mary Gloria, what inspired its formation of what is today called the Coalition of Cancer Champions, and what are the goals?
The Coalition of Cancer Champions was born out of the need for cancer patient-led organization. I need to stress that word, cancer patient-led organizations, to come together and then form a common front. Individually in our different non-profits, we've been doing so wonderfully well, but we have been doing things in silos. Yes, we are doing different things in different ways in silos. And what we have been doing is to have direct impact, positive impact on cancer patients in Nigeria. Abigail is into palliative, Gloria Cancer Foundation is into women cancers, Doze is into colorectal based in both Abuja and the East. Denise is doing schools and IDPs, and Nepicine is doing a lot of research, emotional support to cancer patients, and then promoting change of policies in cancer care in Nigeria. So individually, we have been doing so well. But there was a need that if we really want our voice to be out there, we needed to come together so that it makes things easier. From any part of the country that something is happening, any of our members could just easily, represent. And so that was what formed the decision to form that coalition called the Cancer Champions Coalition, C3, which was beautifully and wonderfully launched on the 24th of November at Eco Hotel during the Cancer Survivors Conference. And so our objective is this. We want better treatment for cancer patients in Nigeria. We want research to be done. We want clinical trials to start happening. We want to be at the table when decisions that concerns cancer patients, cancer care in Nigeria are being made. Because I realize that cancer patients are not really considered when all these policies are being made, and sometimes it's difficult to say, okay, this organization comes. But with the coalition, the policy maker deals directly with the coalition, and anyone on that coalition could come up and propose exactly what we as a group has agreed on. So that is the reason why we formed the C3. And I am super, super glad and grateful to God that it happened.
Thank you, Gloria. Very nice start to explaining this. And you know what? See, that's one of the things I like about this program because when you plan things and then you last start to listen to conversations, you start to realize that what next, what next. So thank you very much. As you can see, C3, the coalition, the conference, those are important steps because for us to go into 2024, these would not have happened. So I'm going to go to, I think I better go on the advocacy question. So this is for you, Miss Abigail. What specific gaps in cancer care and advocacy do you believe should we be looking at that needs to be addressed in Nigeria as a whole?
Thank you very much, Denise, for that very important question. The gaps are quite a few, and what we've discovered is that there are gaps that are reoccurring. No matter how many conferences you have, no matter how many gatherings you have, you always end up with the same recurring factors. One of the very important gaps that I think has been our theme for the conference is the lack of people with lived experience in policy making and on the table where decisions are being made concerning healthcare. And that is a really important gap because who better to help with formulating appropriate policies than those who have gone through the system or been failed by the system. But let me quickly run through a few things. One of the very important gaps is lack of infrastructure and personnel. We're all aware of this JACPA syndrome. We are losing medical personnel at such a rate. And it's not enough just to say, oh, we're going to train new ones. We need to find a way to retain the ones we have and retrain the ones that we have, because it's really important that not only, because even if you have the best infrastructure in the world, machines do not diagnose by themselves. You need personnel that can actually do the job. The next thing is equitable access to medication. That remains one of the biggest challenges that we have. Yes, we do have the Cancer Health Fund, but it's limited. It's limited in the cancers that it covers. It's limited in geographic coverage. So we need to find a way to expand the coverage by the Cancer Health Fund, and then also provide cancer medication access in our national health insurance scheme. It cannot be funded out of pocket. As we've always been talking about, cancer patients are the most expensive beggars. It cannot be paid out of pocket. It's just not sustainable. The other thing is patient navigation. A lot of patients really don't know where to go. Once, okay, you've got the diagnosis, what next? So it's really important that we start looking at hospitals and having counseling and patient navigators, helping patients to be able to go through the system. Thankfully, a lot of NGOs are doing amazing work, but every hospital needs to have some social welfare and patient navigation department to help patients to know how to move through the system, because with cancer, timing is extremely important. We cannot underestimate the importance of cultural and spiritual impact in healthcare in our country, and finding a way to incorporate it into our medical system. Because whether you like it or not, if things are not culturally appropriate and do not involve spiritual leaders, our patients are going to continue to die. So it's really important that we look at how we can have spirituality as a very important part, have religious leaders involved as part of the multidisciplinary team that take care of a cancer patient, because it's holistic. You have to take care of spiritual, emotional, social, financial, and physical needs of the patient. That's really, really important. Stigma is another really important thing. We really need to start looking at the impact of stigma. We need to start talking about awareness campaigns in schools, right from when they're young. Catch them when they're young, because imagine a young cancer patient who has been diagnosed. They're scared of going back to school. People will be calling them names. So you need to start them young. Start talking about childhood education on cancer and things like that. Then the other thing that's really, really important is childhood cancer. I'm going to end with that, because how can you not have any dedicated cancer hospital, oncology center for pediatrics? Meanwhile, our population, 50% are young adults and adolescents, so we cannot continue to ignore this. But I really believe as we start to make impact, I mean, we had a fantastic conference. Government has said that they're ready to work with us to put in the gaps. Once we start to see people with lived experience on committees, on policy-making decisions at the table. Thank God we now have a table that everybody can join. I honestly and sincerely believe that we will start to transform cancer care in Nigeria and also Africa as a whole. So it's really the power of lived experience. It cannot be emphasized, and that is what's going to transform cancer care in Nigeria and bridge all the gaps.
Thank you. Abigail, thank you very much. I mean, it's very interesting because to those of you who are watching us for the first time, every single one of us on this platform or talking today are people that have lived experience. And we're not coming from a point of um, medical. We're talking as people who know what it feels like, and we're asking people to start to rethink what you're doing and why. And for those advocates out there, it's a together thing. We cannot win this race if we do not stand together with one voice to make a difference. Okay, Jose, so I'm going to come to you on this one because Abigail has pointed out one thing that we cannot run away from, and that is policies. So how do you envision work, or how does the group or the advocates as a whole, so let's not let it not be just because it's called the coalition, but all cancer advocates across Nigeria, how do you envision, what are you thinking, or how do you think that out this coalition or this group can actually work together to impact policies and drive change? Especially, you see, key points were made with Abigail. It says funding. Because Cancer Health Fund is one thing, but I don't want to go there. I want you to talk about it so that we can address the issues on funding. I've had 6 messages this week, people trying to get access to Cancer Health Fund. That's a discussion for another day.
Thank you so much for this question. And I think it's instructive to just go straight to the point, owing to the want of time. First, it's important for cancer champions and patient advocates to build strong relationship. I envisage this building strong relationship and developing a proper line of communication with key policy makers or policy drivers of the nation. We have established this relationship amongst cancer champions, and that led to our coming together to have that conference that we've all talked about. So I think it's important that we are involved in things that make up this demand, or this that will assess those needs, that will look at, just as we are talking about cancer globally now, as a person or individual and with its unique stories, and cancer not being just a diagnosis, but is a personal thing. So I look at where collaborations will drive that process, for which will increase funding and also increase the improved outcomes in cancer health in Nigeria. And again, I think the cancer champions working together will also help the policymakers to know that they have people who are willing to work with them, who will share those experiences that are needed in that sector for improvement. And again, it's also important for them to put effort into funding, which is the key thing in this sector, to look at how we can pay more attention or increase the funding that is available for health, and look at the priorities of these people so that more effort, more people will be put into this space. Just like we know, the burden is huge and it's not something one person can do. So connection, compaction, collaboration is something that will help to, that I am looking at, what we as a people with lived experience are looking at, that will improve the outcome in cancer health. And ultimately, I think the key thing is to establish more advocates, as influential partners, right? To have them as credible and influential partners that will drive sustainability in cancer, in healthcare, and improvement. So I think it requires persistence, it requires collaboration, and a solution-oriented approach, which will help us for advancement. Thank you.
Thank you very much. They'll say thank you. They'll say, you tried. Thank you, Duzi. It's interesting to continue to look at this conversation, and let us be very honest with ourselves, because 2024 is totally different. 2025 is coming. We're coming to the end. All of us here are privileged to still be alive. So, and to those of us going through this journey, I'm going to emphasize one thing. The funding mechanism, please, can the government put that thing out publicly for us for 2025? Because as advocates, we do not know. We need to know how to support people who have cancer. It's all well and good for us to sit here. We've struggled this battle. We keep fighting. And like I always say, the cancer patient is the most expensive begging community in the world. It's not about Nigeria. It's not about UK. It's not about anywhere. Cancer patients have to seek funding every time. And so as I get to my last question, which goes to Gloria, what message would you convey to Nigerians about the importance of joining forces to tackle the cancer burden?
Okay. Thank you so much, Denise. I think the most important message I would like to convey to Nigeria, the government, the people, is that there has to be a lot of emphasis on prevention and early diagnosis. If we have to design a screening policy that will ensure that people screen at the appropriate time, I think that would help us catch a lot of cancers early. Because as we know, one of the key factors that has spiked our mortality rates is late diagnosis. We have to start thinking on how to get in people early at the clinic, diagnose them early. We have to start educating people they meet first point of call, which is usually the primary health care. But how much do they even know about cancer? You'll be shocked that someone could be giving a woman antibiotics for a lump in her breast because the ignorance, I've seen some health practitioners, the ignorance about cancer is shocking. For a country that has the kind of high cancer burden and mortality we have, you will be shocked that certain healthcare workers who should be at the first point of call, where people go to when they first feel the symptoms, know next to nothing. And that is alarming. So we have to pay emphasis on prevention and screening. We should have a policy that will ensure that people screen on time and catch them early. Secondly, also, we have to start looking at how to hasten treatment time. So some people actually present early, and then by the time they start treatment, they're in stage 4. And all of us as survivors, we know what those factors could be. One of them could be denial, could be money, could be navigation, so many problems along the way that could make someone that would have been diagnosed and treated at stage 1 to be treated at stage 4, greatly limiting their chances of beating cancer. So as a country, we have to be intentional. It's not about always talking and hosting conferences. We have to start being intentional on how these treatments can start early. We could give ourselves a timeline that anyone diagnosed with cancer should be undergoing treatment in the next 30 to 60 days. It's doable. And in doing that, we know the things that comes to play. Money has to be there, and we cannot overemphasize the importance of universal health funding for cancer patients, and psychological support, psychosocial support, all-round psychosocial support, because many people are going to deny it, they're going to run away. How do we keep them in the loop until they start their treatment? We should have a time and work towards that time. And then the third one is survivorship. Survivorship is another aspect I think we should start taking, seriously. So it's not enough for you to catch people early, assuming we start working our talk in this country, and then we treat people early. Within 60 days, someone's undergoing treatment already, hallelujah. And after the treatment, they say, oh, you're fine, so go home and sin no more. That's the word the cancer patients used last time. That the doctor said, go home and sin no more. And then you go home and you do your Thanksgiving, you're happy, and before you know, the cancer is back, and the person is thrown into total darkness, depression, and pain because you are not prepared for the intricacies of survivorship. So as we end the treatment, let us start preparing patients for survivorship, for possible recurrences, for the hospital visits, for the monies that you're going to spend, for the stigma that will come after survivorship, for the relationships you're going to lose after survivorship. Survivorship is a whole world of its own. But sometimes I think it's even scarier than the treatment if you want to look at everything that comes with it. So these are the three key areas I think the government and the people should start paying very key attention to if we are going to, have have better outcomes, have better quality of life. These three areas has to be factored in every step of the way. Thank you.
Thank you, Gloria. Thank you. I say one of the things I'm going to say now is I really have found this interesting more than I really realized, because for some strange reason, you all have just captured our world in a very short interview of the lived experiences of cancer patients, not just in Nigeria, but across the world. Together we fight. Together we will win this race. And as we draw to the end, I'm going to want to close this thing by appreciating a few people, because all of us cannot be on the platform, but there are people who have also played, or organizations who have worked with us. And so let me end this by saying, firstly, to Eco Hotel and Center Points, you really helped us do our conference. We appreciate you. To AIT, you're the reason that our program runs every 2 weeks, and I am so grateful, and I think the cancer space is very grateful to all your support that you give us. And to two very important cancer patients, that organizations that worked with us on this project, appreciation to the Solon Collier Breast Cancer Foundation and our childhood cancer champion Kemi Adeusi, who are not here, but as you know, we only have a short time, but I want to say a very big thank you to them. On behalf of all of us, we want to thank everybody. This is the end of 2024, and this is, I think, going to be our last major interview for the year. So I would like to say, ladies and gentlemen, thank you all for all you do for the cancer space. Thank you for all you do for cancer champions, cancer patients, championing our cause, and to all cancer champions across Nigeria. Well done for all the work you do. I think the government can see it. I think everybody knows how much you're doing, and together we fight, together we win. So as I end, I'll say, follow us all on the social media platform, Common Cancer Foundation. Please don't forget, there's a giveaway, 25,000 to as many people as we raise enough money for this December, and the next 1 week we'll start to give it away. We won't give it to you so that you don't spend it before the time that you need it, because then everybody starts struggling. We want to make sure everybody can get chicken on their plate this Christmas. So share, subscribe, and click on the notification button. You will find this video online on our YouTube channel before the end of the week. We look forward to seeing you, and please, when you check on it, you will see every cancer champion that is represented here and not represented here on that link, so you can actually follow and find them. So ladies, thank you. Mr. Dozie, thank you. Thank you for joining us. And to all our stakeholders, thank you. Thank you all for joining us. Guys, our message is very clear. Together we'll fight. Together we win.